to the utmost level of quality, could be easily standardised or benchmarked against any international best practice. I'm not going to comment on other hospitals' experience with pregnancy termination because I'm not in a position to comment on that. I can tell you, though, that the statistics that I quoted to you, about 57% of our patients with a prenatal diagnosis of Down syndrome do indeed travel for a termination of pregnancy. 50% with a diagnosis of trisomy 18 travel for a termination of pregnancy, but 50% don't. And that, to me, demonstrates absolutely good, balanced counselling of patients. Almost an equal number of patients who are diagnosed in the Rotunda with trisomy 18 or trisomy 21 choose to continue as choose not to. To me, you cannot get any more balanced than that. If I had statistics that were 99%, 1%, one way or the other, to me that would raise the question of someone else doing something wrong in terms of their balance. I don't think our numbers could be any more balanced than what we're actually seeing. You referenced a study from prenatal diagnosis. I'm very familiar with the study by Cope and colleagues from prenatal diagnosis that suggested that there was an increased incidence of various measures of psychological trauma or upset after they terminated for various abnormalities. I would not accept that paper as being a good example to learn from. When you look at the methodology in that paper, many of the patients that were recruited in that came from social media campaigns or patients who were tracked down or recruited through social media. So to me, as a clinician scientist, and I do a lot of research studies, I've published a lot of research studies, how you recruit patients into a study is crucial to the outcome from a study. So if one recruits patients who might have a certain viewpoint already, and if you go to social media to recruit them into your study, it's not at all surprising if your results would be in a particular direction. So the unbiased recruitment of patients is absolutely crucial to any science that is done in any specialty, and that would be my concern with the Cope paper that you cited. And I do believe that all of our patients have rights to health and well-being and dignity, and that's what we strive to do day in, day out with our patients. We listen to our patients, what their own personal values are. We provide them with the information, and one family, one set of parents might decide one direction and another direction, and that's okay. That's acceptable because that's our job to be professional, and I think we continue to do that.